today. I have been with Premier close to 20 years, so I've been on the medical side of social work that entire time. And a lot of what we do as medical social workers are work with our patients and families to help develop a good long-term plan. And a lot of times we see with our patients, they are very well taken care of, but we focus on our caregivers at that point in time because it can be a really tough role to be a primary caretaker. So just to get us started, being a caregiver, I say, is not for the faint of heart. Being a good caregiver, whether for an elderly family member, a person with disabilities, or chronic health conditions, requires a blend of patience, compassion, organization, and resilience. If you've ever been kind of in that sandwich generation too, where you're caring for a child as well as parents or grandparents, that is also a tough position to be in, and I can speak to that personally. In addition, self-care is imperative when you're caring for others. We will explore several key tips to help you be an effective and balanced caregiver. Being a caregiver starts with being good to yourself. So first and foremost, when you're a caregiver, practicing empathy and compassion is extremely important. Putting yourself in the shoes of the person you're caregiving for, trying to understand their fears, feelings, and limitations. Putting yourself in the shoes of that person that you're caring for is one of the most powerful tools in caregiving. It's called empathy, and it's what transforms tasks into compassion and connection. It's important to stay patient, which can be difficult, especially if you're having to be repetitive, asking a person to maybe put their shoes on, or are they hungry yet, and they forgot within the first couple minutes of you making that statement. Repetition, slowness, or mood swings can be frustrating, but you being calm can help reduce a person's anxiety. Responding with dignity and respect, recognizing that they are still a whole person, not just one who needs help. Try to imagine the world from their perspective. Imagine how they are feeling physically, emotionally, and mentally. Communicate kindly and clearly. Use simple, respectful language and check for understanding. Listen actively. Often they just want to be heard, sorry for my typo there, and not fixed. It's really important just to try to put yourself in their shoes and realize that it can be a difficult position for somebody to be in, having to ask for help or knowing that they need help, whether it's a mobility issue or a memory issue. And then watch for nonverbal cues. Body language and tone can communicate more than words. Pause and reflect. Before reactive frustration or resistance, ask, if I were in their situation, how would I want to be treated? Use respectful adult language, not baby talk. Ask rather than command. Would you like help to get dressed? Versus, you need to get dressed now. Stay organized. This is super important and also can help reduce burnout. Keeping a daily routine, which helps both you and the person receiving care. Keeping a routine in caregiving is one of the best ways to create stability, both for your loved one and yourself. A predictable day can help reduce stress, confusion, emotional outbursts, especially for those living with conditions such as dementia, Parkinson's, or chronic illness. Routines matter because it creates structure in a day that might otherwise feel chaotic. It can reduce anxiety and behavioral changes, especially for those with memory loss. It builds trust, cooperation, eases transitions like mealtime, medication, and bathing, and helps you manage time and hopefully avoid caregiver burnout. There are some useful tools out there. I know we were kind of talking about technology in the very beginning as we were waiting for everybody to arrive. Technology has come a long way. There are apps out there, medication reminders, that kind of thing, but a lot of my suggestions, it's just the good old-fashioned notebook. When I'm working with patients and families, I suggest keeping a spiral notebook and writing down some of those routines and then helping to create a structure for the person that you're caregiving for. That's kind of important too if you have multiple caregivers. So say you have other family members coming in or maybe some private pay services coming in. then they can kind of follow what you've been doing with that individual. Learn about that person's condition. Educate yourself on the medical, emotional, and practical aspects about their illness or needs. That's definitely important when you're caregiving. Make the doctor take time to talk to you about the illness or the condition that you're caregiving for. It's very, and you all know when you go to the doctor, you have that like maybe 10, 15-minute block. The doctor's in, how are you feeling, checking vitals, refill your meds. They're out the door. Definitely make them stop and talk with you, especially if you're starting to notice any like behavioral changes, caregiving needs are changing. That's what the physicians are there for. And just educating yourself can help you anticipate what challenges could be coming in the future. Most importantly, take care of yourself. And you're probably like, Heather, that's easier said than done when you're a caregiver 24/7. But burnout is real. You can't pour from an empty cup. Taking care of yourself as a caregiver isn't a luxury, it's a necessity. When you care for someone every day, your health, your emotions, and energy matter just as much as theirs. Schedule breaks, ask for help, and use respite care if needed. There are a lot of community resources. Here in Warren County alone, there's the Elderly Services Program. There are multiple agencies in the Miami Valley that do private pay care. I've left my information out there, my card with my contact information, so if any of you in the future had questions about what might be available, you're welcome to reach out to me. But there are a lot of options out there. If you're a veteran, there are options through the VA system, which can be cumbersome, but if you get a social worker on your side, we can help navigate that. And then support groups. Sharing your experience with others can really help. Especially, you might look at me and say, well, Heather, how do you know how I'm feeling? Unless you've actually walked those shoes as a caregiver, which is true. And I have in some ways, but it may be different. So finding a support group, finding your people that may be experiencing some of the same things you are, maybe they found something that could help their loved one that could ultimately help you. Be flexible. Conditions and moods with anybody can change rapidly, and just be ready to adapt. Letting go of perfection. Trust me, that is a very hard thing for me as a type A person and a social worker, but I know in a caregiving role, as I have a teenage daughter and then also caring for both of my parents who have significant health issues, I have to quickly realize that what I think is perfection doesn't matter as much to them as long as they know that I'm there for them and I'm caring for them. If the day doesn't go as that is exactly how I want it to, I may struggle with that internally, but they don't know. They don't know that my idea of perfection is like impeding things. They just know that they're being cared for. You have to acknowledge your limits. Say to yourself, I'm doing the best I can with what I have, which I'm very guilty of struggling with myself. And let go of the guilt of not being perfect, because we're all human beings. Setting boundaries. This can be difficult too, but clearly define what you can and cannot do. It's okay to say no sometimes. Maintaining your personal space and time to preserve your own mental health. Remember that setting boundaries isn't selfish, it's survival. Without boundaries, caregiving can consume every part of your life. With them, you can sustain your role while honoring your own needs, limits, and identity. Encourage independence. This also can be difficult, but let that person do what they can, even if it's slower or messier. It still gives them a form of ownership, a form of normalcy if possible. And again, that can really be challenging with somebody with some memory deficits, but they might remember, hey, I used to like to make breakfast in the morning, I want to make this oatmeal, but they're asking for some help making that oatmeal, and it can be frustrating because it's daunting every day and you're repeating the same things, but it's important to let them have some involvement in their activities if it's possible. Losing independence, memory, or mobility can be really, really difficult for that person. Finding a task a person can still participate in, it can be very empowering to them. Celebrate the small wins. Whether it's a good day, a shared laugh, or a small step in progress, acknowledge it. This is a powerful way to stay motivated, and build resilience while reminding yourself that what you're doing matters, even if it doesn't feel like it on those hard days. Self-care for caregivers. Self-care is essential. As I said, it's not a luxury, it's a necessity. When you neglect your own well-being, you risk burnout, resentment, even with your own health issues. When I often say to our patients and caregivers is that we can see, we're home health care, so we're in patients' homes. And we may have nursing therapies in their social work. We see that patient is taken care of extremely well. But then you start to see the caregivers maybe a little frustrated because they've got their 5th call from the day, which can happen when you've got home health care, multiple staff coming in. And they might be a little irritated, a little snappy, even with us. That's a red flag. That is a call for help without them asking for help. So we try to focus on that at that point in time. We know that our patient is taken care of. Now we need to just shift our focus to that caregiver and how can we intervene to help. Sometimes it's just a listening ear too. Very important to acknowledge your limits. Know that you can't do everything, and that's totally okay. That can very much be difficult. As I said, on a personal note, I struggle with that myself, but I have to, at the end of the day, say that to myself. Accept that feeling overwhelmed doesn't make you a bad caregiver, it makes you a human being. Prioritize rest. Again, easier said than done. I know when I had my daughter almost 14 years ago, people tell you, sleep when the baby sleeps. Well, that's easier said than done, and us as parents know that because you feel like you have to constantly, you got to get the laundry done, you got to get the dishes done, and that's an opportune time to do that. And sometimes caregivers feel the same way. Well, I'm so busy watching my wife right now that when she goes to sleep, that's when I get the household chores done. But you cannot, again, pour from an empty cup. So take that time and then ask for help around you if you need it. Sleep is not negotiable. We all need sleep to run our bodies and function every day. Even just a quick nap, again, sleep when the baby sleeps. I struggled with that, but I know as a caregiver to my father now, if he's napping on the weekend, I can do that laundry later. I might go ahead and nap myself. Again, too, sleep can get interrupted, especially I think about some of our individuals that have the memory issues, dementia, Alzheimer's, and those that struggle with sundowners. So they're up in the night, you're worried about them getting out at night. We offer suggestions on getting alarms for the doors, different things to try to keep that person safe and then allow you to get some sleep too. So that's important when you partner with a provider or social worker to help get some of those things in place. Take breaks without guilt. Use respite care. There are options out there, unfortunately. Many of our insurance plans and Medicare do not cover respite options, but there are county programs. Warren County has the Elderly Services Program. A lot of these programs are based on income, which can be frustrating at times, but definitely worthwhile to check into those. I mentioned the VA system. If a person's a veteran, even their spouse can be eligible for some services, private pay help at home that the VA covers. Sometimes two people pay into long-term care insurance plans that can also pay for individuals to come into your home and provide care. And when I talk about respite care, that could be more like somebody's coming in from an agency. They can provide hands-on care to your loved one. They can do the bathing, dressing, make a meal, or simply companionship and watch over them while you're going out to an appointment or simply going for a walk. But taking a break is super important for your own well-being. Movement, I don't know if any of you enjoy walking, yoga, stretching, but even just a quick lap around my yard sometimes does me some good. Getting my daughter on her bike while we're helping my father, and knowing he's down, he's napping, we're good to go. We'll go out and just spend some time in the yard, and that taking that deep breath, that fresh air really helps me. And then nutrition. We all know you got to eat well, nourish your body along with the rest. Eat regular balanced meals. Please don't try to skip meals and rely on, I know I can be guilty of relying on caffeine and those energy type boosters to keep you going through the day, but that's not nutrition. And hydrate. I know that's going to be a topic coming up. Hydration is extremely important, especially during this time of year. But I always keep, even when I'm over helping my father, I always keep a tumbler full of water and just try. You do have to remember, I can carry this around all day, but I have to remember to drink it. But I just got in the habit of like bringing this with me, and then that was just kind of a reminder to stay hydrated, because my own health has taken a hit at times because I'm not taking good care of myself. So I do want to focus on that part of the self-care. And then protect your mental health. It's extremely emotional to be a caregiver, especially if you're caring for a loved one and you're watching them go downhill, decline over time. That hurts your heart. In addition to, you know that some of these things are changing, and how's that going to change your life too? They might need more hands-on care. They might need help with toileting and bathing and dressing and sometimes feeding, and that can all take emotional toll when you're used to that person being so independent and taking care of things themselves. And then try to maintain a life outside of caregiving, and that's important if you have any sort of support system around. Sometimes people will say, well, just let me know if you need help. They may not offer a suggestion because they don't know what to do to help. Just simply ask them, hey, I'd like to get out to go to my card club. Can you come and sit with my husband for an hour today? Try to focus, if you have a hobby or something that you enjoy, or simply just it's a walk a couple times a week in the park. Try to keep that in your life and not let that go by the wayside. Then again, to the social media, stay connected with friends or family, even if it's virtually. Sometimes I know my in-laws, they enjoy, we call them once a week, and they actually tell us when to call because they're typically busy themselves. But they enjoy that and they look forward to that. So that's the way that we stay connected to them. And then setting realistic expectations. Heard me say multiple times, letting go of that perfection. Good enough is often more than good enough. Track what's going right, and not just what's going wrong. Setting realistic expectations as a caregiver is one of the most important ways to protect your well-being and support your loved one with compassion and clarity. When you expect too much from yourself or others, it often leads to guilt, frustration, and burnout. Realistic expectations create a space for grace, patience, and sustainability. And then ask for help. As I said a couple moments ago, be specific. If somebody says, let me know if you need anything, take them up on it. A lot of us can be guilty of, well, I don't want to bother them. I don't want to be a burden. If somebody is offered help, they want to help. They may not know what to do to help. And so ask them, can they come over and watch your loved one while you just go take a walk, go to the doctor, whatever that could be. If they want to bring you a meal, let them bring you a meal. That's the one less meal you have to cook. But most importantly, knowing the warning signs of burnout. If you experience these on a regular basis, it's time to pause and definitely ask for help. If you're constantly feeling tired, whether it's emotional or physical, feeling detached or hopeless, being irritable or having some resentment, the trouble sleeping, and then you start to get ill. All of that ties in, and the last thing that we want for anybody is to their physical health is going to fail. Because what's going to happen to you if you get really sick, end up in the hospital, but you're the primary caregiver for that loved one. So that's why it's really important to reach out for help. Take anybody up on their offers for help, and then use those resources available in your area. This is essential because burnout doesn't show up all at once. There's going to be like a build up to it, and it'll start with some small red flags. It often happens when you're focused on everyone else but yourself. Remember that you're doing important work, and you don't have to do it alone, and you don't have to do it perfectly. Noticing the signs of burnout shows strength, and taking action is survival. There's nothing wrong with any of us asking for help. It actually makes you a stronger person to say, hey, I'm putting my hand out, I really need some assistance. Does anybody have any questions at all for me as we were talking today? 'Cause that's about what I have, but I thought we might have open discussion if anybody going through an active caregiver role now that you'd be open to sharing.
I have a question about
Yeah.
after
Yeah.
caregivers. So let's say you've taken care of someone for a long period of time, and then that person, eventually is going to pass away. What, what are some tips that someone can use to manage that loss and then that routine that you've had for several months or several years?
That's a great question. That's where I think it's really important to seek out those area resources in the midst of caregiving, because a lot of the resources that I'm aware of actually have supports for individuals after that loved one has passed. I hesitate to bring up hospice because I know people think, oh my gosh, that's at the very end of life, which it typically is, but sometimes we've had patients graduate hospice. But if your loved one has a chronic health issue or even dementia, Alzheimer's, hospice is a wonderful option for care nearing end of life. But I bring that up because they have wonderful supports for caregivers after. And that can be, family members, friends even that have been in that caregiver role. A lot of the hospice agencies in our area have that awesome support. The other thing too is trying to make your own routine. Everybody's gonna have to go through a grieving process, and that grieving process looks different for everybody. I think it's important to go through the grieving process, but then also start to get back into your own routine. So think back to what were some of the things that I once did prior to being that caregiver, and how can I get that kind of going back into my life now? Yeah, it's a great question. Anybody else have any questions?
I have a question, but I think I'm curious when it comes to caring for others. Were any of you surprised that the linchpin to that was caring for yourself? That a lot of it starts with your own personal self-care, and how that can make you a better caregiver when you actually care for yourself. Was that surprising for anybody that that's the linchpin of it all?
I think it's hard because I was in a situation where I still had kids that I was taking care of. Then I had my mother who was starting to show signs of dementia, and my dad trying to help her. And I think even though I thought I have to care for myself, and I probably should have, I could not. I was just sandwiched. I was trying to run here, get here, and so it was really, really hard until probably I got to burnout, and then it was too late. But it's so important, and I think you forget that, if you aren't available, if you aren't the one who's able to provide the care, there might not be anybody else there.
Exactly.
So it is definitely the linchpin, I agree.
Yeah, it's easier said than done, for sure. And I've had to figure out ways myself. This sounds silly, but again, going back to the technology, but I use my phone reminders to, I've got medicine I need to take, or hey, let's plan for dinner, and just those kind of things that'll like trigger, because sometimes I'm very guilty of just getting in the motions of things and then realizing I'm not taking care of myself. And my little family would be in the world of hurt if I wasn't well myself.
I think it's about too, just even on the front end of it. My sister takes care of my mom. So you're sharing today kind of gets me thinking about that aspect, and they're in other states. I don't get to be a part of the caregiving support very much, but it's just just on the front end, so you don't get to burnout, right? So you don't get to exhaustion, and you can be present and involved. I think there's an aspect of getting those systems in place early, so you have supports, whether it's calling an agency or talking to other family members, talking to somebody at a community center or church, whatever the support system you can create, I think getting that early before we're just so exhausted that now we're desperate to just get some type of relief. So I think having those systems in place where the load is shared, I think caregiving on its face is very difficult when it's just one person responsible
Absolutely.
for the caregiving. So I think there should always be if possible, plural people, even if it's just a couple that can help, who can help share the load. And if there's not family members or the people, are there agencies that we can reach out to early to get that process started? So it was tough for my sister because we grew up with the expectation of we will care for our parents. And so I think when you grow up with that expectation, when you get into it, it can be very exhausting. Even though you love your loved one, whoever that might be, it can be overwhelming. And then you feel guilty.
Yes.
For
And it's
how
a vicious
you
cycle.
feel about caring for that. Like, you know, like, I don't know why am I feeling this way? I knew this was coming. And so it can be a daunting task, but if you go into it where the expectations are clear that we should not expect to care for our loved ones alone, if at all possible. And I understand there are situations and times that you do just have to, you don't have anybody else. But if we can get those systems in place, I think it's really, really beneficial. So finally talking to my sister about that and saying, hey, you're by yourself, she's single and you're caring for mom, you work full time, you're active in life, you cannot care for mom by yourself. How can we as siblings support you? What are different agencies we can get to come in? What can we do so that you don't bear the brunt of it yourself? And I don't know if anybody's also ever experienced the loved one that you're caring for almost making you feel like you should be the only one to care. Has anybody ever experienced that? I did with my mother-in-law. I stayed home with the kids and she got sick, and so we were sandwiched. We were little kids, we had little, she got sick early. And my husband worked, and it was almost expected that we should be the ones to take her while I had 4 little kids and care for her. And it just wasn't tenable.
It's very tough.
And she was very resistant to us getting extra support or seeing if there was, assisted living someplace close by we could still see her.
Yeah.
And she was very hurt. She felt very rejected that we would even consider putting her in a home. We don't want her, and it's like that's not what it is at all. So I think sometimes those things can pop up too in the caregiving process.
Well, and I appreciate you bringing up too, getting outside support early on is helpful, or even just knowing what's available early on that you might not want to enlist that help yet. I say that because especially if you're looking at an area community resource, there are certain counties, depending on the resource, where there could be a wait list. It might be best to get your name on that wait list, that when they call you up and you don't need the services yet, just say, keep my name down. But that way you're not facing what I call a crisis later on. I know sometimes just in our work as home care social workers, we see that where our nurse will say, hey, we need to get a social worker out. Caregivers really, really struggling. And I feel helpless as a social worker because I can't get something set up immediately because of the constraints of funding and that kind of thing. We try to work miracles. We try to get things set up as quickly as possible, but I do appreciate you bringing that up. I will say down here in Warren County, they're usually pretty quick to get help enlisted. But yeah, different counties, and of course, just the funding and things. So I do appreciate you bringing that up.
Are there places kind of they can check online? Is there just this is my ignorance, just a county website they can check for those types of resources?
Yeah. Actually, if you go just to the Warren County site or type in Warren County Elderly Services, their website is wonderful. They talk about everything that they can provide, from meals to somebody coming in to do a little light housekeeping, that kind of thing. I did leave my business card out there on the table too. I don't mind if any of you reach out to me via phone, email, if you had more specific questions, or even 6 months down the line, you could say, hey, I attended the talk in Springboro. I'm always happy to help, because I tell my patients that too, and their families. They have us for a short amount of time for home care, maybe a couple months, but we all know things change over time, and sometimes things are changing for the worst, and I don't ever want anybody out there lingering that could benefit from some help.
I have a couple observations.
Yeah.
My husband was diagnosed a couple years ago with Alzheimer's,
Mhm.
so we're going through that process.
Yeah.
And a couple things I've realized about myself: if I don't get enough sleep, I'm cranky, I'm irritable, I answer the same question 50 times a day.
Yes.
But if I have the sleep, it really helps.
Yes.
And just in the last few weeks, I'm trying not to be so upset with myself if things don't go the way I want them to go.
Good.
We have certain things I want him to do. I want him to get exercise because that's so important for cognition.
Mhm.
And I want him to stay hydrated. And some days those things don't happen.
Yeah.
And I would be upset with him. I'd be upset with myself. And so I'm trying to relax and
It's
just,
hard.
if we don't get out for a walk today,
Mhm.
we didn't get out for a walk.
Yeah, we'll
There's
try
always
tomorrow.
tomorrow. I just know for my own well-being, I have to just kind of step back
Mhm.
and, yeah, today was an okay day, but we've got tomorrow. We'll start
Right.
again tomorrow, so.
I appreciate you sharing that. That is key right there. I think too, I could sit here and talk about this all day, but you have to trial what's going to work best for you and your situation, and I appreciate you sharing that, because it's very, very difficult. You would think, having that routine and having these things, if everything could go right every day, this is difficult being in this role, but it makes it a little bit easier, and I'm glad to hear you're trying not to be as hard on yourself. That's important, because otherwise you're going to hit that burnout, and we don't want that. We don't want that at all. And please reach out, and anybody, if you're in that caregiver role, it's hard to ask for help. I know, as a helper by nature and being a social worker, I offer help all day, but do I ask for help? I don't. Which is, practice what you preach. And I need to be better about that myself. So actually, my husband pointed that out to me. I didn't like hearing it from him right away, though.
And I would dare say, Heather, that those of us who are helpers are probably the worst people
Yes.
to actually ask for help, because we expect to be the ones to have it together, to
Have all the answers.
And so we tend not to ask for help.
I'm a home health care nurse by trade.
Oh.
I've done that for 15 years, and I've always taken care of everyone with dementia and Alzheimer's. Well, my husband's been diagnosed for 5 years with Alzheimer's, so he's really decreasing here recently. But and you were talking about Warren County. Warren County is great. He now has the Meal on Wheels comes. We don't really need it, but they came and they said, you're eligible for it. Get the frozen meals, and it works out great for
Yes.
lunch for him. They bring them. We get the frozen ones, so every day he gets, and they're just like home cooked meals. They are really good meals. And so he was eligible for the 2 days a week to go for 4 hours a day. He wouldn't go. We went, and he wouldn't stay. He said, she's a nurse, she takes care of me.
Yeah.
That's
Just what Janella was saying.
He
That's
doesn't
the
want
thing.
anyone. She's a nurse, she's with me. So it's like every day I'm with him, he won't let me cut loose
Yeah.
from him.
Yeah.
On Tuesdays, one of my daughters comes and stays with him, just visits with him, for 4 hours a day. And it's like the only getaway. It's like, my sons have even tried and get him to go out to eat. Well, Dad, let's go here. We'll go get Chinese. Mom doesn't like Chinese. No, we'll go somewhere where she likes to eat. We've been married 49 years. How
Yeah.
do you cut that tie?
Yeah. Well, and you have that double-edged sword too, having worked in the healthcare field, and he's caught on to that. But like, well, she's also a nurse, so she can. I'm in the best hands, which he is. But you need that reprieve.
Hard to cut that tie there.
Yeah, yeah.
Do you think if you said, I have an appointment, I mean, that would, and maybe you have that appointment a couple times a week,
Yeah,
I think
Yeah.
that would give you that break.
yeah. Even if I say I'm going to the doctor's, I have the doctor's, well, I'll go with you.
That's what
Yeah.
I said, I said, he'll go
He
with
thinks
you.
he can go.
Yeah.
Because he always has, you know.
Yeah.
That's the thing.
Well, and that's part of his routine too,
Yeah.
and him not understanding that you kind of need a little break. Yeah. But I like too what you said about somebody coming over and it's visiting, and he sees it as visiting versus.
Yeah, and that's the idea that I've
Mhm.
always told my clients is I don't want to come in as a nurse, I come in as a friend. So
Mhm.
if you do have someone come visit your loved ones, if you come in as a friend, because most of them aren't going to remember if they know me or not,
Mhm.
I come in as a friend, introduce myself, and or you may be a friend of you to where they think, oh, well, this is just a friend, and they welcome me more than coming in as a nurse. So.
Mhm. Yeah.
I'm a home care nurse, and I might work where you work. And
Are you
my mom
Julie?
suffered- Yeah.
Yeah. Heather Carey.
Oh, yeah.
We work together.
Yeah.
I was like, I know her. I kept looking at her.
Many years. On March 6th, my mom went from independent to total care. She had a fall, so it's been huge change. But, and I cry every day.
It's okay.
But I was late today because Warren County's at my house for like the fourth time. So I will admit, it's amazing, and like respite care, like they'll do a week of respite care for free, the county pays for it. I never knew that. I've been a home care nurse for 27 years. Hospice will do 5 days of respite care, you pay for one, they'll do 5 more days. So those are free services I didn't know. My parents live in Warren County. They were very hard workers. They saved from their 20s. So they're not rich, but they're, they've saved. But they will qualify for them to help put a ramp in their house. These are things as a home care nurse that I didn't even know.
Yeah.
We have hired private care through private aid, word of mouth, and care.com. But that would be my point as a caregiver, that we have somebody in the home 17 hours a day taking care of my mom. Sometimes we have 2 people taking care of my mom because she's bad. She is physically exhausting and emotionally exhausting, and she calls for my dad constantly. What I have found, and I guess my point is, if you have the means to hire a caregiver, it's beneficial, because I look at my mom and I want my mom back. And the caregivers look at her and they're like, I just love your mother. She's so sweet. And my mom is, she's hard. She changes on a dime, from quiet to mean to crying to, irritable. But people see her differently. Like, I see her as who she, I want my old mom back. And I have rehab goals, that we're not meeting, and so I'm sad. So it's been very helpful for me to have paid help in the home. One, to give me a break, and I do go out and walk and, just try to step away. But it's good to hear them bring positives, because I don't see that. It's been, it has not been a gradual change for me. It was an overnight change. So that would be my advice. Like, if you have the means to hire somebody, or if the county, the county's even giving my parents 3.5 hours of aid services a week, and they're not in that Medicaid range. They're above that. But because my mom was so bad, they do qualify for that. So, and My friends call, and if anybody offers a meal, I say yes. I do Kroger click list, but I don't even have time to go pick up my groceries. And I've had coworkers pick up groceries and just bring them to the house because there's times that I can't even leave. So, you know, I've learned a lot more in the last 4 months than I did in 32 years of nursing.
It's very difficult when you've worked in the healthcare profession and you're on the flip side as a family member. And Julie, I appreciate you sharing that.
Yeah.
Just know you have a whole team behind you too. You just need to reach out.
Fidelity's been very good.
I just wanted to ask you something. The caregivers that you have or hired, are your parents okay with them, or
Yeah.
do they prefer you there?
Well, like my dad will say, nobody takes care of your mother better than you. But I set boundaries, and when she was in the hospital, she's not a typical person at home. My mother doesn't walk, she can't tell you what she needs. So she's not she's not an average home patient. So I knew that I had to do a lot. I mean, I trained the people in the home. But I set boundaries and said, I can take time off of work and cancel vacations in my life for so many months to get a routine and a schedule and, train people how to care for my mom. And I think my dad was very grateful because she would be in a nursing home had I not done that. So, they have been accepting of that. My mom, she doesn't know me. She called me a good little boy the other day, so she doesn't know who, sometimes she'll look at somebody and say, who are you? But she doesn't recognize most people she knows. So she's whatever, right now with the people in the home.
Well, and usually too, if you're hiring private pay, I know even just for our company, they try to keep the same staff member in if feasible, and that puts a familiar face. That can also be difficult if your loved one has memory issues. But I can speak on a personal note. When my grandmother had lung cancer, and we had hospice services, but we also had some private pay help coming in. And we had two particular ladies that she absolutely grew to love. And they took care of her like she was family. And that gave us all some comfort, because again, you feel guilty, you're not there 24/7, but she knew we had jobs and things to take care of. But those ladies came to her funeral to pay their respects. And you get the right caregivers in, and that's why it's important. Like if you do private pay, agencies are recommended. Those staff are vetted, they're background checked, all of those things. And you get somebody hired in, if they're not working out, it's okay, especially if you're paying, it's okay to say, hey, I don't think this person's gonna work. Can we try, another staff person? You have to be comfortable, and most importantly, your loved one has to be comfortable with that person coming in. But Warren County, I will keep touting, some counties, and it again depends on population and the resources available, but Warren County's Elderly Services Program is phenomenal. And Fidelity, our home care company, covers 17 counties, so Warren County is one of the best.
You see a few things. Is anybody not in Warren County that's in here today? Okay. I'm
Yeah.
sorry.
What county are you from?
Montgomery.
Okay.
Montgomery, so
Yeah.
that's where we work.
Yeah.
I live in Warren,
Yeah.
so we work in Montgomery County. And there's some, you probably know more about Montgomery County resources too.
Yeah. There's the Area Agency on Aging for Montgomery County, but as you know, Montgomery County doesn't have the funding to offer some of the options that you're hearing about within Warren County. A lot of what might be offered, you have to meet that Medicaid eligibility, which makes it then difficult. But we do some digging around as social workers to try to find help. Yes, ma'am.
I'd just like to interject. What if you have a sibling that takes advantage of your parent that you're caregiving and creates turmoil as children, that are trying to help, and and takes advantage of the situation. How do you deal with that? I mean, I had a sibling that came in and knew what was going on, so she thought she was entitled and started wiping everything out. That's another negative of all this, because no one would believe she would, you know, that
Yeah.
what was happening, and now we're left to deal with this, and we still can't just, I mean, she thought she was entitled, and that was her reason for stealing so much from my parents, and it still leaves, I mean, they're gone now, but it still leaves so much, you know, resentment.
Oh, of
How
course.
could you do such a thing? And my mother knew what was going on and cried constantly when she looked out the window and saw her car was gone, and we knew where it went, and there was nothing we could do. I mean, that's the negative of this. How do you deal with a sibling that's not on the same page as you are?
That's honestly, and I hate to bring this up, but a lot of times when our loved ones are taken advantage of, it's going to be somebody closest to them. They're realizing that mom, spouse, whoever, they're vulnerable. They may not start to realize I'm taking a little money out, or just even creating turmoil within the family. But when it comes to, I mean, that was definitely some financial exploitation. There are entities in place that can help. Every county has an adult protective services agency, and that's where if you're starting to see those kind of things, especially financial, or God forbid, you know, some of our individuals are physically abused, verbally abused, adult protective services needs to intervene, and anybody can call. You know, if there's a healthcare worker coming in, we're all mandated reporters. We make those referrals more than I'd like to say. I'm sorry that you went through that. Is that your sibling still causing turmoil, even though your parents
Well,
are?
it's all, she got everything.
She got
It's all
everything,
gone.
yeah.
But no one would believe us, and they went from independent care to assisted living to Alzheimer's.
Yeah.
And we kept telling them, we asked them to take the key away to their apartment from her. They wouldn't believe us, and they would do nothing. So they came in the front door and went out the back, and I mean, everything's gone. No one would believe us. And I wasn't the only sibling. I mean, there was 3 of us, and everybody would never believe that, oh, she wouldn't do that. Well, she did, and no one ever came to our, I mean, no one would believe us.
Did she have like a power of attorney that was allowing her to take, I mean, she
No,
essentially took
she just
control
No,
over?
she just did.
Wow.
I mean, that's just the negative of this. You have to be careful, and maybe your siblings will all get along. We thought we did too.
Well, sure.
It didn't turn out that way, because she thought she was entitled.
Yeah.
Because
Well-
we had more than she had, so she thought she was entitled to get everything she could, and she did.
Well, and that's the unfortunate part too, is that sometimes that a difficult situation can bring out the worst in somebody, and that definitely
Yeah,
occurred.
because who would have ever? I mean,
Definitely went on was not legal. When things get to that situation, and say your loved one can no longer competently make decisions, there are routes people can go. And I don't mean to get too much in the weeds, but that to me is talking to a physician and initiating a guardianship case with the probate court. Getting a responsible person overseeing the day-to-day for your loved one, not only making medical decisions, but overseeing financially, because the courts then monitor making sure that person is doing the right thing financially, not wiping somebody out.
And I would even say too, even on the front end, you can tell I work in health prevention. On the front end, everything for me is prevention. On the front end of it, having that scaffolding in place is who's the power of attorney, who's responsible. I'm the youngest of 5 kids, and so there's 4 of us left, and we have people who are responsible for my mother's care. She's able to still do some things on her own. How was my mom? 83? She's 83 now. And so my brother is her financial power of attorney. So he handles all of her money. So, and because he's great with money, we said, hey, take it. Medically, I probably know the most, so I make a lot of her medical decisions when it comes to her care. So that kind of defaults to me, but my brother and I share that responsibility. So we have people in place who can do those things, because like you said, I've seen it happen. I know you have too. Too many times we just assume our family's gonna do the right thing. They're gonna make the right decisions. And like you said, it brings out the worst in people when they see an opportunity. Things that you think people would never do, they tend to do when they can take advantage. And so last month we talked about hospice and aging in place. And we mentioned having a lot of that scaffolding in place. So as we become less young and we need more support, we have those resources already done. We don't have to scramble and do it. But it's nice to know the resources there should you need to have.
Yes, I appreciate bringing that up. I'm a huge proponent, having worked in healthcare for many years. I started my social work career in Good Samaritan Hospital in Dayton, which is no longer, but I worked in the ICU. And it's so important. I don't care what age, as soon as you become age 18, having a healthcare power of attorney is imperative. And then doing the financial side of things too, because none of us knows what each day could hold. And I could fall ill or be in a tragic accident, and I already have my decision makers.
You need an alternate power of attorney. Because like my dad,
Yes.
my mom is my dad's power of attorney. So she no longer can make decisions. So he already had the kids set up as alternate. But the same, my dad is my mom's power of attorney, but now I'm his backup, so he gets ill. So if you don't have that, you need that too.
Yeah, extremely important. In the state of Ohio, just the medical power of attorney, you can list up to 3 individuals to be decision makers. Just keep that in mind. I'm very passionate about that, having worked in, especially starting my career in the ICU, and patients would come in and if they were put on life support, put on the ventilator, they could no longer make decisions for themselves. And then you have family. We had a brawl in the ICU where family members were not agreeable on what needed to happen, and there was not legal documents. So the hospital then, we assisted with getting a guardian appointed and helping with all the paperwork through probate court. You want to avoid that if at all possible. Any other questions or comments? Well, I appreciate your time. If you have any questions or anything that should come up in the future, my contact information, I left business cards there on the table. You're welcome to reach out to me anytime. I wouldn't mind at all. Just, you might want to give me a gentle reminder that you came to the talk here in Springboro. And then right away I'll remember. Thank you.